Hello and welcome to my channel. We are kicking off a series of 100 flashcard rapid review diving into clinical anatomy. Perfect for revision whether you are preparing for USMLE, PLAB or any other exam. Today we are starting with the skeletal anatomy. Let's get into it. So how many vertebrae are in vertebral column? Of course there's 33 vertebrae, 7 cervical, 12 thoracic, 5 lumbar, 5 sacral fused and 4 coccygeal fused. So what distinguishes thoracic vertebrae? Thoracic vertebrae usually have facets for ribs articulation. What distinguishes lumbar vertebrae? It are larger and lack transverse foramina and costal facets. So what is the function of atlas and axis? They together helps in nodding motion like no. It is due to no is due to the atlas and axis, whereas yes is because of occipital and atlas bone. So what is tens and where it is located? Tens is the projection of C2 axis vertebrae that articulates with C1 vertebrae that allows in rotation. Then what is contained within the vertebral canal? So it houses the spinal cord, we all know. What is the primary function of vertebral body? It supports the weight of the body. What is the function of intervertebral disc? It is the shock absorber and allows flexibility of spine. So what are kyphosis, lordosis and scoliosis? Kyphosis is thoracic curve, lordosis is lumbar curve and scoliosis is lateral curvature of spine, as you can see in the image given. So what is the key landmark of scapula? It consists of acromion coracoid process, scapular spine and glenoid cavity. What are the landmark of humerus? It has head, anatomical neck, surgical neck, greater tubercle, lesser tubercle and olecranon fossa. So what is the clinical significance of surgical neck? As you can see in the image, this is the surgical neck and it is the common site of fractures, especially in elderly. So how do the all radius and ulna articulates with humerus? Radial articulates with the capitulum of humerus and ulna articulates with proclea. So there's a mnemonic to remember carpal bones. It is some lower tribe positions that they cannot handle. Total of 8 bones which consist of scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate and hamate. So what is scaphoid fracture clinically significant? It is prone to a vascular necrosis due to poor blood supply. So scaphoid fractures are again of 3 types. It can be distal, waist or proximal depending on the position of fractures. So what is Colles fracture? It is the distal radial fracture which dorsal displacement often from falling on an outstretched hand. When you fall with an outstretched hand, there is a fracture in the radius, as you can see. This is the, if it's outward then it's a Colles fracture, and if it's inward it is called Smith's fracture. Now we are towards the bone of the lower extremity. So what are the key landmark of pelvis? It is iliac crest, ischial tuberosity, pubic symphysis, acetabulum. And the landmark of femur, it is head, neck, greater trochanter, lesser trochanter, medial and lateral condyles. So what is femoral neck fractures and its clinical significance? It can disrupt the blood supply, leading to avascular necrosis of the femoral head. So what is the tibial and fibular contribution to the ankle joint? So tibia forms the medial malleolus and fibula forms the lateral malleolus, and it stabilizes the ankle joint together. What is the clinical significance of talus and calcaneus? Talus is critical for weight bearing and calcaneus fractures can severely impair mobility. So what are the major bones of cranium? Cranium consists of majorly frontal, parietal, temporal, occipital, sphenoid and ethmoid bone. And what are the main sutures of skull? It is coronal, sagittal, lumboid and squamous, as you can see in the image. What is pterygone and its clinical importance? Pterygone is thin region with several clinical bone meat overlying the middle meningeal artery, and its fracture can lead to epidural hematoma. What is herniated disc? It is the protrusion of nucleus propulsus through the annulus fibrosus, potentially compressing spinal nerve. As you can see in this image, the inside nucleus propulsus is spread out from annulus fibrosus, and it can compress the spinal nerve. So what is sciatica? It is the compression of sciatic nerve, often due to the herniated discs in lumbar spine. And what is spondylolisthesis? It is the anterior displacement of vertebrae due to the fracture or defect in pars ventricularis. As you can see in this image, this is the sciatica. This is the sciatica where there is the damage of sciatic nerve due to spinal stenosis. And there is this spondylosis and spondylolisthesis. So joint structure and injuries. So what are the key ligament of knee joint? There are usually key 4 ligaments, which are anterior posterior cruciate ligament and medial and lateral collateral ligament. What is ACL injury and how it is diagnosed? ACL injury are, you must have heard in the footballers, ACL injury are more common, and it is the damage of the anterior cruciate ligament. It can be diagnosed by anterior drawer sign, where the tibia can be pulled forward relative to the femur. So what are the meniscus? So you can see here there is the lateral and medial meniscus. They are the shock absorber and stabilize the joint. Which direction is most common for shoulder dislocation? Anterior dislocation is more common due to the weak inferior part of the shoulder capsule. So what are the muscles of rotator cuff? It consists of mostly superior spinatus, inferior spinatus, teres minor, and subscapularis. You can see in this image as well the superior spinatus, inferior spinatus, teres minor, and subscapularis. So bone development and pathologies. What are the primary and secondary ossification center? Primary ossification center form in the mid shaft during fetal development, whereas secondary center form in the epiphysis postnatally. What is the epiphyseal plate's role in bone growth? It allows for the longitudinal growth of bone until it fuses at the end of puberty. So what is achondroplasia? It is a genetic disorder that affects cartilage development, leading to dwarfism. What is osteoporosis? It is the condition characterized by decreased bone density, increasing fracture risks. So clinical symptoms and syndromes. So what is carpal tunnel syndrome? It is the compression of medial nerve within the carpal tunnel. As you can see in this image, there is the compression of median nerve in carpal tunnel. What is the cranial nerve that affects the Bell palsy? It is the facial nerve 7, which has following features like drooping eyebrows, drooping eyelids, facial nerve, and drooping corner of the mouth. What is thoracic outlet syndrome? It is the condition caused by the compression of brachial plexus subclavian artery or veins at the thoracic outlet. What is cubital tunnel syndrome? So there is the ulnar nerve causing symptoms in the ring and little finger. You can see in this image as well the ulnar nerve, which supplies to the ring and little finger, is affected. What is Morton's neuroma? It is the thickening of the tissue around the nerve, leading to the toes, often causing pain in the ball of foot. What is brachial plexus injury and its common cause? It is commonly caused from the trauma from shoulder dislocation, childbirth, which causes Erb's palsy, or penetrating injuries. In Erb's palsy, we have the following features: adduction and medial rotation at shoulder joint, and extension at elbow joint, and pronation at radioulnar joint. So what is slipped capital femoral epiphysis? A condition where the femoral head slips off the neck at the growth plate, commonly in adolescence. And what is Lex-Calves Perthes disease? It is avascular necrosis of femoral head typically in children aged 10 to 4 to 10 years. Here there is an interrupted blood flow to the head of the femur, which causes necrosis.